happy to bring another episode with a new guest onto our platform. Let me tell you that this is not going to be an ordinary interview. This interview is a slight departure from the normal. And why do I say that? It's because this interview is not with a traditional commercial P&L business leader or a person who has spent years in sales, marketing, and other functions. We are going to be interacting with a leader who has the vision of building one of the finest biotechnology companies in India and abroad. She is Kavitha Iyer Rodrigues. Kavitha is the founder and CEO for Zumutor Biologics based out of Bangalore. Kavitha is a scientist at heart, and she's extraordinarily passionate about building platforms and solutions for diseases that afflict mankind, especially in the therapeutic areas of immunology and oncology. Zumutor Biologics is a startup company based out of Bangalore and has its labs based out of Cambridge, Massachusetts in the United States, as well as facilities based out of Bangalore. It is a company which has a novel proprietary human antibody platform, which is devoted to the science of NK cell therapeutics for oncology. And many of you who work in the therapy area of oncology would immediately understand as to what I'm talking about. The novel proprietary human antibody platform helps to generate antibodies which not only target and regulate the tumor environment, but they also help building and strengthening the innate human immunity. Towards this exercise, the company has been working feverishly towards building first-in-class drugs on the oncoimmunology platform. Kavitha is a medical scientist. She's a medical microbiologist from Bangalore, and she's also done her executive MBA from the Indian Institute of Management, Bangalore. She has over a decade experience in the life sciences industry. She was first employed in the corporate sector and worked with companies as research scientists in Biocon, Avastagen, as well as Merck Millipore. But somewhere along the way, I suspect very strongly that the entrepreneurial bug bit her very strongly. And she decided to become an entrepreneur and set up her first company called InBioPro Solutions, which was again a biotechnology platform solutions-based company. After a very successful startup venture of InBioPro, it was sold off to an investor, and then she devoted herself to building two more biotech startup companies in Bangalore, one of which is Zumutor Biologics. As I said earlier, Zumutor is devoted to building first-in-class drugs in the immuno-oncology space. And all of us who work in the industry know that this is one of the hottest, most exciting, and very, very active therapeutic area with blockbuster drugs coming to the market every year virtually since the last 7 to 8 years. We've already had two biggest blockbusters from world-class big pharma companies such as Merck and BMS, and many more are expected. So I believe that today's interaction will be of significant interest to pharma marketeers who are in the space of immunology, oncology, and specialty care, but also those who find biotechnology as a very interesting subject. So without much further ado, I would look forward to this wonderful interaction with Kavitha Iyer Rodrigues, who is the founder and CEO of Zumutor. So first of all, I want to start off by thanking you. So it's been worth it, actually. Thanks so much for accepting our invite.
Thanks, Sailesh. And it's been wonderful to reconnect after quite some time. And I did see a couple of the episodes. They're very slickly and nicely done.
Thank you. Thank you so much. Kavitha, thanks for your time. I respect you have a very busy schedule, but then I said that 1 hour would be very, very useful for our, community of pharma marketeers, right? As I outlined to you before, we have over 1,000 plus strong marketing community in India, and we have viewers from the Indian pharma industry.
This is great. This is great, and more power to the series. And of course, the viewers getting, more importantly, value from what they're listening into.
Absolutely, Kavitha. So thanks so much once again. I actually wanted to kickstart a conversation, because it's when I saw your, I've been through your profile, it's very interesting. And so my first question is, when you look back at your almost a 2 decades career, it's been an inspirational one for many, many people because
Thank you.
transition from corporate to entrepreneurs, ventures. You started off, very successfully. You've also now head up Zumutor, which is at the forefront of developing novel therapeutic antibody platforms in the immuno-oncology space. So I just wanted to start off our conversation, how do you feel your journey has been in this last 1.5, 2 decades? And I just wanted you to share with our viewers, what have been your highs? What have been your lows? What's the kind of learnings or some things, which you carry with you every day? I just wanted to have that as a starter.
Sure. So I think, it's definitely been not a journey that I thought I would get on, but a journey that I want to say has been very memorable, very different. And I want to say it's kind of set the grounds and standards for things to come. So to that extent, I am extremely, blessed to have peers and mentors in the space, who've been quite instrumental and influential in the kind of choices that I made. So if you take it back a little bit, from straight off my clinical masters in Manipal, I joined Biocon, right? And at that point, Biocon was, I want to say small, given the context of the current size. It still had the enzyme division with it. It was smaller compared to what it is now by means of size, number of people, etc. So my journey started off there. I want to say with enzyme development, then on to some of the newer antibody development, etc. But I think what I did learn there was, apart from big company exposure, which I think is extremely important, is the whole, merit and importance to rigor. There is rigor and standard, and there is a lot of repetition, which could be, very numbing, but at the same time, now I know all of that rigor is something that has held me in good stead. So I think there was an amazing exposure with both, peers and colleagues that I had there. And very importantly, one relationship that was forged there, I want to say, which even today I would say, she continues to be my mentor and somebody who inspires me is Kiran. Right? I mean, the phenomenal work that she has done in this space, she continues to pave the way for multiple things. So I think I'm very fortunate that, the stars aligned and that I got to work, in Biocon. And even in Biocon, as I worked in kind of departments that were there, I think my colleagues, and my seniors and a couple of others gave me, I think, a flavor of what the larger industry was and where they came from. Right. So I think that back in 2001, I was very fortunate to have. Fast forward 2000, kind of 5, 6, I spent some time in Millipore where I did get some amount of experience with core process development, which is across India. And if you remember, cut 2005, 6, that is really where Indian pharma was transitioning to biopharma, and biopharma was looking at, kind of recombinant vaccines, was looking at multiple newer assets, not compared to today, but newer assets from a pharma basis. And I was very fortunate to be a part of that change. So I have worked in the labs, which includes like the Reliances, multiple pharma companies in the Gujarat area, in Hyderabad, spent quite some time in Shanta Biotech then, right? And I think I want to, and Shastan, etc. So I want to say that given the exposure of those kind of pharma companies that were transitioning to biotech, that itself aided my growth. And I'm very proud of being in the trenches with all of those folks and, getting that kind of experience. And I think that kind of shifted my kind of, I want to say base of skill and experience to antibody development. I think that was the pivot then. And then off to my first startup, which was completely in the biosimilar space. And as you would know, right, 2007-8 was a good time. There were patent cliffs. There were multiple pharma companies looking at very compelling biosimilar pipelines. And so these pipelines were either indigenously developed by them, or they were very keen to look at onboarding startups that did it, right? And so that was a great time to do that startup. And so 2007 to 12 was my first startup in BioPro. And that is really where my first investor, who continues to be the lead investor in this one, came in. Axel's previous avatar, which was Erasmic, came in, and they did, they did see light of day with a good exit. So I want to say this journey has been a very different one. I did not ever fathom that it would be chartered like this, all the way from some amount of enzyme development, scale up manufacturing, to all the way to antibody engineering and development, to biosimilars, and now, of course, in Novel Biologics, right? So it's been a great journey. It's definitely peppered with a lot of funny and yet, kind of tearful stories too, because all of this comes at a price. And I've been very fortunate to be a part of developing ecosystem in India, which has been even the evolution of the DBT from the time it was to BIRAC to the chapters that are there now. So I think I'm very fortunate. I was there at the right time, at the right place.
With the right people, most important.
Yes, absolutely.
All right, that's great. One of the things that strikes me, and what you mentioned in the opening few minutes, is you were a person who actually worked in the trenches. And, when that transformation was happening from pharma to biopharma, whether it was Shasun or with Shanta. So what would be your message? I mean, you can't learn the ropes till you actually work in the trenches, pull up your sleeves, right? Or it's not just the white collar job of working with your white lab coats in the labs. You've got to do the dirty work, or the spade work. What would you have to say on that? Is that also important as a part of the learning curve?
I think it's absolutely important. And we have seen this with both the startups now, with all of the newer kids who come with great pedigree, but zero experience. There is no other shortcut but to work literally in the wet labs, doing all the work that is to be done, get a fair idea about what it takes, and then move up the rung. I think that's a very important step. And we've also learned with the newer kids coming from, kind of pedigreed places, their expectations and how to manage those expectations. So I think it's a dual learning here, right? With regard to hard work and kind of keeping at it, and then the learning on our side saying, what does it take to keep young people now in the new workforce engaged?
Workforce engaged. Okay, great. Yeah. Being a woman entrepreneur and moving out from corporate and deciding to set it up all on your own, right? Obviously, and then how difficult or how easy was it in this space? And any challenges, and what were the kind of stuff that you did in order to actually build it out is something that I would love to know. Yeah, we would love to.
Right. So I think the gender card is a dual one, a dual-edged one. I normally never play that, but I want to say that there have been, challenges. I would not necessarily say for myself, but I can see it across, other women in the industry, not necessarily biotech, but in other spaces, who find it extremely challenging to kind of elbow and nudge it out in a larger space. So I empathize with this. I am possibly very lucky and of the few who've not really had, too many challenges in this particular, kind of eking it out. I want to say I have been mentored well. I have been fortunate to access VC capital pretty early, etc. So to that extent, I want to say being a women entrepreneur in the space has been kind of path-breaking, but at the same time, fortunate to be mentored. But the other piece of it that I now live to tell a story is in the VC space. Right, as I continue to kind of raise money, kind of look at, growth for Zumutor, etc. I don't think there is a dearth of, like a gender card to play. but it's more to do with, the attention that one seeks from VCs, especially in a tech space that is like ours. There are very few and far between who understand us. So it's a different challenge and not necessarily the one to do with like a women entrepreneur piece.
All right. All right. No, thanks for clarifying that. And I think I like the position that you took on it. Thank you so much, Kavitha. I want to move to I want to take your perspective on the current, how do you look at the Indian biotech space, right? I mean, the pharma, which merges, like the biopharma in the India space, I don't know how much it would be closely associated, is basically working on developing biosimilars, from the affordability access standpoint for the large number of patients, not just in, the rare diseases like oncology or immunology, but also in the mass therapy areas like, say, diabetes, etc. But traditionally, what we have seen is across, the platforms of, say, insulin or erythropoietin or vaccines, as you mentioned in the opening, and now with real biosimilars coming in. Is the story going to actually play out this way, or you are fundamentally convinced that there will be an evolution and, along the value curve, and you will see new biologic entities coming out of India at some point of time from a pilot scale-up batch to something which will really rock the world? How do you see that happening, Kavitha? I just wanted to, because you have been in that space and every day, so I just thought of asking you that. Yeah.
Sure. I think it's a very relevant question, Shailesh, and you've kind of summarized and tracked that space well, right? And you would have seen, 2007 to 12 was a good time to be in the biosimilar space. There were multiple approvals happening, approvals by means of, kind of release in India, European countries, ROW markets, etc. Now, once that curve hit and I want to say matured by means of, development, scale up, access by means of regulatory approvals, and therefore access and reach, and therefore pricing, etc. All of that, I think, reached maturity between, I want to say, 2012 to 14. Then it was about what is next, right, for biologics. And I think in a what is next is where I think at Zumutor we played a key role, even in India. We decided to get on the wave of the next piece of novels, and purely novels, which means it's not tinkered compounds, it's not readjusted compounds, it's not about just regulatory pathways that are different because it's readjusted, just increasing half-life or stability, etc. These were completely novel, assets that we wanted to work on, for which we developed a platform, and then our asset base is from the platform. Of course, we are in the space of checkpoint immuno-oncology antibody space, which is very niche and carved out. But to your larger question, is the space evolving and developing like that? Yes. And we are very proud and fortunate to be in the forefront of where we started off in 2013. And now we have an asset that we are going to start with phase 1 clinical trials in the US, and of course in the rest of the world markets also. So I think that transition, even in India, has happened. Multiple biopharmas, you would see, have really compelling pipelines, which are, again, focused in multiple therapeutic indications, but they are novels, whether it be in a small molecule space or in the large molecule space. A couple of examples are like Origin is looking at it, Intas is looking at it, Biocon, with its multiple things like Bicara, Immunil, etc., is looking at it. So I think investments are moving into that area. There is work and specific hiring happening in that area. I think that will make a difference. And you would know what's happening in the CAR-T space. Phenomenal development in the CAR-T space, and very, very proud of Rahul Purwar and others working in the space who are doing phenomenal work.
Right. I was about to address that at a later part of the conversation. Yeah. Therapies. Tell us something about your first venture in BioPro. It was very exciting as I was reading that 5 years, your first baby as an entrepreneur. So how did you set it up, and what was it all about, for our understanding, as far as in BioPro was concerned? Yeah.
Sure. So in BioPro was set up in, the June of 2007. And when we set it up, we were a bunch of folks who knew what was not working, right? And so it was clear to differentiate, saying what we will get done. So we decided that biosimilars were in the asking. There were multiple players, pharma companies who wanted it. There were patent cliffs. There was a technology issue by means of getting clones of high fidelity. In India, developability was an issue, regulatory approval pathways were an issue, etc. And we knew how to crack this. So we decided to kind of set up small and in Bangalore. And we sought VC capital right away because we knew this is not one of those things where you go to banks, we go to grants, etc. You need large amounts of money. So we went to Axel, and at that time they were called Erasmic, and we raised a small amount of seed funding, which we helped to set up the labs. And ultimately, we set out, and the total team size was 27. And 2007 to 2010, we did some really exciting work with lupin, 3 molecules with them. We then worked with Panacea on a hepatitis B surface antigen. We then had MOU signed with Piramal, Shasun, etc. Right, where we were looking at working on pipelines where we would develop from clone to all of the data, which includes transfer at scale, and show all of the analytical data, and then transfer it to the manufacturer who would take it forward to a large scale and ultimately regulatory approvals, etc. So I think we were pretty good with the 3 assets that we worked on. And then in 2010, we realized either we had to set up manufacturing ourselves, or we would have to pivot to be a different kind of company looking at global access. And at that time, we were fortunate to have Arun at Strides looking at a biologics biosimilar pipeline. And so he decided to do a strategic investment, and he had access to 8 molecules. And those 8 molecules were ultimately how we sold the company in the end of 2012. And that gig continues with them as Stelis. Of course, Stelis is now a pure CMO, and most of the team, etc., moved there. But I think working with Arun was a great experience. It's phenomenal with the kind of things that he does in the generic space and the kind of foresight he has with investments. So that was a great learning when we were there at InBioPro. And then ultimately at an exit point in 2012 end, Axel did realize value. And, as founders, we exited and we realized that what is next for us? And that was what we were seeking.
Wow. Kavitha, would it be fair to say, because I've seen many companies, not just yours, because of the inherent risk involved in terms of investments to returns ratio, especially in the biotech space, right? It's a risky business. It's not something like a predictable business like the pharmaceuticals, API business or whatever. The fact is that you build out the novel entities up to the lab level, and then you pass on the asset to the larger company, which has the deep pockets to kind of commercialize it. And that's what Glenn Marks of the world have done it in the initial around the 2000. So does that business model still continue, or now you find that with more funding and more kind of guys, VCs coming into the space like Blackstone or KKR or whoever it is, now people are saying, why should I give my entity to someone else? Let me go it all alone and build partnerships. What's your take on that? Does that also happen, or how is it going on right now?
So I think people are consolidating core expertise, right? Okay. So if it's going to be R&D expertise, I think these units are getting hived off, right? Than to cumbersomely hold it together as a part of manufacturing. So I think those silos are pretty neat, but also the cross-functioning between them has been set up. I think experience says how it's set up. So if you notice how most of these big pharma work, and you would have seen it, they have core R&D units which are working on, say, novels, they're working on ADCs or bispecifics or CAR-Ts, etc. They seamlessly integrate with, kind of process development, scale up, manufacturing, etc., across different units. It need not even be the same company, it could be different companies, right? So I think that consolidation has happened, and it also gives them the freedom and flexibility to onboard new platforms and new molecules when they are smaller and independent, right? Than be a part of like a complete big behemoth. That also we have seen happen in India and across. And I think that's the trend in even a larger, mid-size, large-size, listed biotech, biopharma, even in buying companies out of their pipelines. That's what you see.
All right. Thanks a lot. Thanks for that clarification. I want to now understand your great journey in Zumutor, right? And the setting up of Zumutor probably again being at the right time was when the immuno-oncology space was actually beginning to take off big time. And you had the Mercks and the BMSs of the world, cracking it big time in various indications, etc. in the immuno-oncology space. So I want to know from you your great ride at Zumutor, and you obviously have built a company on the proprietary platform on the NK cell therapeutics, and you have the human antibody platform. How has been the journey? Why did you select only immuno and onco as the two therapy areas? I'm sure there must be a thinking to it in terms of not just the potential or the patient pools or the kind of return on the dollar investment, but more other than that. So I just wanted to hear your story of the Zumutor story, as I would call it.
Sure. So I think the Zumutor story was a very different and exciting one. Also because one startup done, you know how to do things, and you also know how not to make the same mistakes, right? So that's excellent. As long as these learnings are not too expensive. So when we set up Zumutor, the core team of us, we knew that it's going to be a tough and differentiated journey. Number one. Second, a lot of people are getting into biologics, biosimilars, so you need to differentiate yourself. So the third part of it was, if you did differentiate yourself, are you going to license in something from outside, or are you going to develop it out yourself? So I think the third question got answered first, and that was possibly a good order of things for us. We decided to, work on a platform which becomes the golden goose for generating all our assets. And we decided to keep the platform and the asset base together. So today, Enabler, which is the human antibody platform, is a great platform that generates novel antibodies, and it's possibly has amazing potential if you have to give it out there and have multiple partners. But today we hold it together. And I believe it also means it's a harbinger for better things to come by means of the ability for somebody else to pick us up and to move on. It's a great platform to have. So we kept it together for a reason. 2013 to 15, we were an Indian entity. We were invested by a whole slew of, very marquee, investors in the Bangalore area. We had Axel as the lead, Chirate Ventures, which was IDG then, Arun Capital, Kitwin, which is a small state fund, had come in. They had put in $6 million then. We built out our labs, which is in Kenya, which is close to CCamp and IASC. And that's really when our journey began, from, kind of 6-7 of us to, now we are 30 people after like 8.5 years. So I think this journey has been about building it out organically, but smartly. And I think the investors also kind of realized the importance with regard to slowly setting up things. And when I mean slowly, kind of getting all of the pieces in line, which means, we used CCamp as our incubation center. We ensured IP is completely secured from go. So we used KNS partners in India. We used Cooley in the US. We ensured that anything that we work on has to have use case. And so we collaborated globally to do it, etc. So all of this took some time, and we did that. And I think our investors, though they knew less about biotech, were very patient, and they supported this journey. 2015 is when we realized that the main key game of, kind of differentiating our platform, what could it be used for? It could be used for multiple things. And one of them was immuno-oncology assets. And that was progressing, in 2011, 12 onwards. Those were things, checkpoint antibodies were in vogue. So we decided to kind of onboard that. And I want to say we were the first ones in India to use CRISPR and Talon, which are gene editing tools. And, we created our backending platform, cell lines, etc. And we started working on a set of antibodies. And when we flipped the company to be a US company, the reasons also were very congruent, that we would raise capital globally. We would have access to partners globally. Our asset would be licensed globally. So with those reasons, we became a Boston-based company and a wholly owned sub in India. So that was the journey till like 2015-16. And I think 15-16 was really when all of the important work started, right? Which was the focus on the pipeline, the immuno-oncology pipeline. to your question, Shailesh, with regard to Merck and, for example, Keytruda, etc., I believe we have, compelling data, compelling, kind of all of the stuff that's required with all our ducks in line for a start of phase 1 trials in the US. So to that extent, we are a good target for licensing. We're also a good target for acquisition. Now, acquisitions, now it's too early for it. We're building out a very robust pipeline. And at a later point, we would consider even listing in the US, right? So I think this journey has been, it's been very eye-opening for us. It's new. There is no precedence in India for us. So there's been learning from the outside. And so we built out a very good scientific advisory board, which is really what has kept us in good stead, including the consultants and all of the pieces that happen in the US.
Wow. Wow, that's really nice to hear that. One thing struck me hard, Kavitha, which you mentioned, I think 3 to 4 times, and that's really caught my attention. You've been saying that your investors have been really, really patient with you. And that's counterintuitive. Yeah, because every time I open the newspaper in India, the story template has now changed. Don't look for those returns, look for long-term sustainability. So you see Google Anandan, who's now a big investor, who's putting out the right noises saying that don't be impatient. It's not about getting that quick return and exiting, about staying in for the long haul. So it's not about valuation game that the VCs have been playing all the while long. And, and it's so inherent in startups, especially in the pharma space. But you have been saying now that you're very patient. How did that happen? Was it an education of your investors, or they already knew that this is going to be a long-term play game? I just thought of asking you.
Sure. So apart from the investors that I mentioned, we also onboarded 2 new investors, right? Bharat Innovation Fund and Sienna Capital. They came in 2019 and then, of course, 21. And all the investors on the board, which include 6 investors, now have put in multiple rounds of capital. And I think the common theme and a fundamental premise across these investors has been that, biotech is a game of the future. It's possibly going to have great value. We may not understand this right now, but it's possibly going to have great value. COVID enhanced their learning that it is of importance. The fourth thing is that I think they by nature, by means of themselves and the presence that they bring in and the investment theses that they have, biotech has been risky for them, but they have taken this risky bet and they know that it's a long drawn game, right? When I say long drawn game, the outcomes would be phenomenal, but the journey could be seemingly slow. And that is the nature of drug development.
Yes.
Right. And so I think they have also, in their own journeys, have understood the nuances of what it takes for a novel drug to be developed, the regulatory milestones and the differences between India and the US, the kind of consultants that we need, the kind of strategic partners that we need. All of this has been even in their learning.
Wow. Okay. Entrepreneurship is not for the faint-hearted, as they say. And it involves a lot of resilience. It involves a lot of risk-taking ability. And you have been ample proof of that, right? In a way, because you chucked your corporate job, you went into a role of being an entrepreneur. And I'm sure many of the people who want to set up their own organizations, who want to actually dream of being independent, but also add value to the, patients and physicians, at times they struggle with this duality of, doing it. What would be your word of advice, or what have been your, how would you tell them or advise them, these are my learnings and what do you think they should be doing? It's just what I thought of asking, because it's not everybody's cup of tea, but you have demonstrated it. So I thought of asking you that question. Yeah.
So you're absolutely right. And you kind of stole words off my script. It's startups are not for everyone, right? And it's definitely not for the faint-hearted, and it's definitely not for somebody who can't play in the long game. And I'm an endurance runner, and I know exactly what it takes to hit a wall and not go further. So I think one is building out a great team. You could have all that it takes to be a phenomenal entrepreneur, but if you don't have a team, I don't think all of that even, it has hit start point, forget you finishing the journey, right? I think the team matters most. Uh, Even with the team, I think, their own journey of why they are in it and what is the end game for them is extremely important. Of course, it could change by means of the, kind of contours of how it evolves over some time. Interests may change, many of those hiccups might happen, but I think as long as your sights are on the end game, and end game for us is like, what is the patient outcome that we could provide, what is the dent in the immuno-oncology faint landscape that we can provide. When that is in focus, I think everything else, kind of takes perspective, right? It's as simple as walking into, a cancer hospital. Once you see patients, then everything that you're doing suddenly makes sense, right? And all the outcomes and all the differences that you want to do make sense. And then it's up to you to kind of stick the journey, as they say, stick a landing in gymnastics, and then, see the difference that it makes to patients. And most importantly, startups like ours are custodians to a lot of money that we've raised. We have to make a difference to investor outcomes, right?
Yes.
And that's also as important, right? So these two, I think, are driving forces. And the rest of it, whether it be geopolitics, markets, flipping up and down, people come, people go, etc., is par for the course. Yeah, this is what you signed up for, right? So, in triathlons, rough waters are what you expect. You swim through it, right? And that's what happens.
Wonderful. I think that's a true story coming from an endurance specialist like you, an endurance runner yourself, right? Wonderfully put. Kavitha, I want to ask you, do you call yourself as a scientist at heart?
So I want to call myself as a scientist by training and now a management professional by means of the work that I do.
Right. That's wonderfully put. Do you also get time to meet up with physicians, patients to understand, because they are your endpoint customers, and all of it from the lab will go on to the bed, from the bench to the bedside, as they say it, right? Your innovations are going to impact physicians who will write products across the globe, not only in India, patients who will be prescribed. So do you also make it a point that you should be very, very careful about how is it going to get commercialized? And do you also spend time doing that part of the side, or you're only in the labs and you said, no, I have a team that looks after it? How does it go?
So from the work that we do and the translational pieces that we, engage with partners for, we are involved with a whole bunch of things which include, kind of patient segregation by means of recruitment for phase 1 trials, biomarker development, all of the translational of, biology that happens globally. We are partnered in Netherlands, we are partnered in New York, etc. All of these pieces are what we do. In the interaction stages of it, we are interacting with a clinical oncologist, right? We do not have direct access to patients, but we do deal with clinical oncologists who are advising us. And I think that is as real world as it gets for us.
Excellent. So that's what I wanted. So getting the first-hand feedback from clinical oncologists, because they would understand where they would place your molecule in their clinical practice, and they would automatically decide patient profiles as a first line or a second line, would then give you enough of meat, I think, to understand.
Correct.
Okay, great. Kavitha, I respect your time, and I'm coming to the closing part of our conversation, which has been brilliant from a standpoint of understanding the kind of work you do. My couple of closing questions is, how to see the biologics / biosimilar space in India evolving from here on, right? I mean, it's been, as I said earlier, more of developing the clones of the successful mAbs, whether it was chimeric or whether humanized monoclonal antibodies or whatever stuff. And today you're seeing it evolve and more seriously. So you did make a passing reference that there would be a lot of traction, but can you help us understand, like how globally you have now the novel CAR T therapies and other cell line therapies, they would eventually come to India at some point. But how would India be the, would it also take on as a crucible for developing NBEs for the future is something I just wanted to pick your mind on. Yeah.
Sure, sure. I think so, Shalish, you kind of set the context, right? With what the future holds for India, I want to say, right? I think with now the current slew of companies, which are quite a few, I want to say in the CAR-T space, and quite a few pharmas in the north looking at ADCs, bispecific, novels, etc. I think the next 10 years, we are going to see a shift, not with just increasing capacity by means of biosimilar production, etc., but I think a shift in one development of complete novels, which has a complete need by itself, and it can be done indigenously, and therefore there is an implication on cost, and therefore what does it cost to patient and outcomes like that. The second piece of it is that it's going to also see some very, very stoic regulatory pieces playing out, right? I mean, so far we knew how to regulate biosimilars, what is the pathways, these are stayed, and it's been done. But this is new. So one, is to kind of, educate the regulators, or the regulators then, pass information and guide developers. I think that's a very important, kind of coexisting relationship. The second piece of it is that, this whole make in India, make for India is not going to be just about scale. It's going to be about novels, getting done indigenously, and therefore seeing light of day, right? We have seen many avatars of it, right? People have licensed in things and, produce it in India, and then, drop prices, and therefore there's accessibility in India. That's one part. The second is, the drugs being available in India directly. The third is to develop it here and therefore launch it here. So I think there are some great ideas being pursued. The BIRAC is working very hard, and of course, all their pieces of it for scale up is there. Multiple incubators, are there, and wonderful science talent is there. I think when these kind of reach its critical mass, you will see this shift in 10 years.
Wow. Do you all, I forgot to ask you a question. Do you also partner with academic centers of excellence, say, for example, in India, like the Indian Institute of Science or the AIMS or etc., to get those intellectual inputs and academic? I just thought of asking, do you do that?
Yeah. So yes, absolutely. And I really think we have a lot to gain by these partnerships. So we partner with Iyer Pune, we partner with CCAM, we partner with ISC. We also work with Tata Memorial in Bombay. Apart from working with Harvard Med School and a couple of others in the US, we work with Mount Sinai in New York. Yeah.
Fantastic. And I think that's great, right? I mean, the indigenous talent from India, especially in terms of biotech, is amazing. You don't have to actually look outside India. What would you have to say on that, right?
I think so. I believe there's phenomenal talent in India, and it's also getting nurtured well. What it requires is for the younger folks coming out of, kind of their first fresh wave of studying academia, etc., to see that there is enough money and opportunity right here. And if they're able to see that, and if one or two layers of them are trying to graduate out of that and, work in phenomenal spaces, whether it be startups or, biopharma, I think that would set the trend. And that's what's happening right now.
Wonderful, wonderful. Kavitha, it's been an absolutely amazing conversation because I have learned quite a few things, which I was not aware of, and I'll be very honest to admit that. But I think it's been a great conversation. So as a part of the closing, end of the conversation, would you like to share anything as specific messages for our audience, not just in terms of the work you do, but in terms of life learnings, advice? Because it's been a journey that's been very well captured, right? So some closing remarks or messages that you feel free, because that would really help our community. And they're not just marketers, but they're business heads as well, and senior VPs. So they've spent all their life doing commercial stuff, but this is something which is much more than that, right? From drug discovery, development, risk taking. So what would be your closing remarks? I just thought of asking.
Sure. Yeah. So thanks, Shailesh. Well, I'm not sure, I'm that qualified to give closing remarks on this one, but I think just to end this, entrepreneurship is an amazing journey, right? It may not be for everyone, but I think there is space for many, many people, especially in the biotech space. I think the VC space or the capital space is also changing. It's in our onus and responsibility to ensure that the VCs learn from us technically, and we in turn learn the ropes of the game with regard to return on investments. So I think it's a dual role, and yeah, and we are responsible.
Thank you so much. It was Kavitha. It was fantastic, interacting with you. First of all, thank you so much for coming onto our platform. So, on behalf of my organization and our community, I want to thank you for your time. You're doing some amazing work, and as I just mentioned, in a jocular way, but I want to see that come as a reality. Is probably you are the next biotech Zarina of this space. After Kiran, and who's a legend herself, and she's been your mentor. But I think we would love to see that first NB come out, from Zumutor and strike the world markets, especially in the areas of immuno-oncology. And thank you so much and we wish you good luck for that, actually.
Thank you so much, Shailesh. It was a pleasure talking to you, and more power to your series and viewership, because I really think you're making a dent.